Hi, I'm Noelle Kelch, registered dental hygienist and alternative practice, and advocate for safe dentistry. Masks are one of the most important parts of a dental clinician's program to protect themselves. They are both a filter and a barrier between the clinician and bloodborne pathogens. Specifically, masks protect both the oral and nasal mucosa from contact with oral fluids, operative debris, and aerosols that are created during dental procedures, such as those created by using a cavitron or the high-speed drill. Those aerosols can contain dangerous bacteria and viruses, so it's important that clinicians wear masks anytime there is the possibility of splatter or spray. That includes not just blood, but saliva. Remember, we treat saliva the same as blood. As important as when we wear a mask is how we wear a mask. Before we demonstrate the proper use of the mask, let's take a few minutes to look at the background and reasoning behind this essential medical device. The American Society for Testing and Materials, or ASTM, set a standard of F2100 that provides the performance requirements accepted by the FDA that must be followed when developing a mask. All claims that are made about masks have to be validated by the FDA following those protection standards. Protection levels for masks go from 1 to 3, with 3 being the highest level of protection. If you're not sure about your mask protection level, just look on the side of the box. It's important to know that you won't find FDA-approved masks at your average big box store. To assure you purchase the right mask, it's best to use a trusted medical supplier. And this is even more important for those in high-risk environments where exposure to diseases such as influenza and TB is more commonplace. In these instances, you may need to go to another level, such as an N95 mask. But how do we apply these protection standards at the office level? To give you guidance, refer to the CDC's March 2016 Summary of Infection Control Practices in the Dental Setting. This document supports the 2003 guidelines we have all been working with. It reminds us that we all need an infection prevention coordinator. Their job is to ensure everyone is in compliance with infection control regulations and recommendations. The chosen coordinator must be educated and aware of infection prevention procedures, including the proper use and benefits of FDA-approved masks, and the need to have them readily available to the dental healthcare professional. In choosing a mask, you should consider the following criteria. First is splatter protection. In the tasks we perform daily, splatter is often generated. It is important to determine the level of splatter involved in the task. As you assess your needs, keep this in mind. For low levels of splatter, you would use a level 1 mask. For moderate levels, use a level 2 mask. And with high levels of splatter, it's best to use a level 3 mask. So choosing the right mask for the right task is important. For example, when doing a routine examination on a patient, generally there's a little splatter and a level 1 mask will work just fine. But in comparison, when using a cavitron, you can expect a lot more splatter. And such, a level 3 mask would provide the proper protection. Fit and comfort are the key reasons cited for non-compliance when wearing a mask. This mask that I'm holding here, Medicom Soft Skin, was designed with proper fit and comfort in mind. Most masks use a rounded piece of elastic that has a tendency to dig into the skin, especially behind the ears. This lint-free, knitted, super soft, flat piece is gentler and conforms more to the shape of one's face. It's mounted on the outside to create the perfect seal. It is sonically sealed to the mask so that there's no rubbing or irritation. The nose is an aluminum band piece as opposed to the twist ties you see with many brands. It allows for better adaptation and a snug fit that stays in place for added comfort. If you're getting a lot of chafing on your face, one of the reasons may be a lack of snug fit. If a mask is too loose, it's going to rub your skin while you talk to patients. So remember, snug fit is best. Fogging while using a mask can be very frustrating, especially when you are doing high moisture procedures. This mask really took fog factors into consideration using a unique tunneling process. This provides lofts to the fabric, making them softer and more breathable for the utmost in comfort and less fogging of your eye protection. The aluminum nose piece also comes into play here by creating a seal that helps prevent fogging. This Pro Shield mask comes with an anti-fog layer and a fog shield. Soft Skin has a cellulose blend that is designed to whisk away moisture and prevent fogging. When you try the mask on, you will see just how easy it is to breathe. These masks are designed for breathing. For example, Medicom Level 1 masks are typically 25% more breathable than standard requirements, and yet the fabric is dependable. The outer layer is high-quality spun bond material that won't tear or shred and is lint-free. The materials used in Soft Skin use a cellulose blend designed to whisk away moisture, especially during longer procedures. The materials are dye-free, lightweight, gentle, and non-irritating. Everything you want and need in a mask. We each have our own tastes when it comes to personal protective equipment. The Master Series is one of my favorites. The vibrant colors are an inspiration and help bring a little brightness to the daily grind of a dental practice. It's important to consider each of these areas when making decisions about the masks we use. As we all know, it's hard to wear a mask properly if it's uncomfortable or is continually fogging up. Medicom SafeMask meet all these criteria. Medical masks are also categorized by performance class levels based on fluid resistance, differential pressure, flame spread, bacterial filtration efficiency, and submicron particle filtration efficiency. It's important to realize that splash guards do not take the place of a mask. When using a mask, the more splatter or anticipated exposure, the higher level of mask is needed. A couple of points about flame spread. The flame spread rating is how fast a flame could spread on a fabric. The FDA recommends Class 1 or Class 2 masks. Medicom masks are Class 1. This means that it will take at least 3 seconds before the flame starts to spread. You may think this is not a concern in dentistry, but there are many areas in dentistry where flames could occur, from the use of a laser to the open flame you may find in the laboratory area. Now let's see the do's and don'ts of putting on a mask. Put the mask on first, then the eye protection second, creating a seal. Secure the elastic over the ears or the tie at the back of the head. Do not twist the band or tie to create an air gap. This will defeat the filtration purpose of the mask. Fit the flexible band to the nose bridge, creating a seal. Fit snug over the face and below the chin, so both the nose and the mouth are fully covered. This will form a seal. Never adapt or manipulate the mask. That means no cutting, scrunching, or folding. This can significantly compromise the mask and reduce its protectiveness. Masks are a single-use medical device. It's recommended that you change your mask every 20 minutes in a moist environment or whenever it becomes soiled. Masks may become damp simply by breathing into them or by exposure to the normal wet conditions found in most dental offices. So remember to change masks frequently. Follow these tips and you'll avoid any problems while using your mask. Never twist the elastic band. Never wear inside out. Never wear as a chin bra. Change if it becomes wet or soiled. Change between every single patient. Just as important to putting on and wearing a mask is how you take it off. The front is contaminated. Do not touch the front. Hook the ear elastic with an ungloved hand and slip the mask off. Never place the used mask on any clinical surfaces or in your pocket, and never lower onto your neck or wear outside the clinical contact area. Discard in a proper and designated waste container. Thank you for watching, and I hope you have discovered not only the importance of wearing a protective mask, but the importance of choosing the right mask for your practice. As you cradle people in your lap and you make their smile a little brighter, their health a little better, please know that as you apply infection control principles, you are making a difference. Today's tip of the day takes the mask to the next level. In the summary of infection control guidelines, it gives us a great standard for cough etiquette in the dental setting. It states, offer masks to coughing patients and other symptomatic persons when entering the dental setting. And provide space and encourage persons with symptoms of respiratory infections to sit as far away from others as possible. If available, facilities may wish to place these patients in a separate area while waiting for care. Having extra masks available for this purpose will help protect everyone in the dental setting, patients and professionals alike.